Hi, good morning, Jeffrey. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Jeffrey Paulson.
And what is your candidate number, please?
My candidate number is 231089228.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me what you feel your greatest skill as a nurse is.
I'm very proud of my ability to really listen to what a patient is telling me. Having spent the past 5 years in the medical field, working directly with patients, has shown me just how far actively listening can go in helping make someone comfortable. During my time working in admissions in my last position, I learned that addressing patient concerns and making sure they felt we were genuinely listened to was just as important as receiving quality care.
How do you handle the stress of the job?
I find the best way to handle the stress of the job is through meticulous organization and attention to detail. By making lists and prioritizing what needs to get done throughout my day, I find that tasks which might seem overwhelming all at once are much more manageable. This also makes it possible for me to stay calm and remain focused on what needs to get done when unexpected situations arise.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when you just can't do more. Seeing someone in pain, or feeling miserable, and knowing there's nothing you can do to help, is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a team, because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating, and am equally comfortable working alone.
How do you ensure you remain up to date on advances in nursing?
I use several approaches to remain up to date. Along with continuing education courses, I subscribe to several industry publications to learn more about what's on the horizon. I also follow thought leaders on social media, giving me additional insights, and converse with my network regularly to find out about their discoveries.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role-play. Don't worry if I stop you when the time is up.
Good evening, Mihiraa. My name is Jeffrey Paulson, your daughter, Mia's attending nurse. I am here to advise on Mia's aftercare, to ensure a better healing process for her.
Okay.
Well, before we step into the discussion, how do you feel about your daughter's discharge?
I am glad that my daughter was treated so quickly, and that I can take her home now.
Thank you for your words. To begin with, let me provide you with some information about the use of slings. Mia has to wear the sling day and night, however, she is allowed to remove it for bathing.
Okay.
It is advisable to use extra pillows for arm support, which will also make her feel comfortable.
Sure, I'll provide pillows for her, as you suggest.
Good to hear that. It is also recommended to continue pain medication for the first few days to relieve her pain. You can give her paracetamol before her bedtime, as well as whenever she experiences pain.
All right. I will make sure to give Mia the pain medication, as mentioned. But, I think, getting her to wear a sling all the time will be impossible.
Yes, I can realize what you mean. Don't bother about it. I can suggest some ways to encourage her sling use.
Oh, that's great. You may please.
Mihiraa, try to convince her of the sling. For that, you can make some customization on it. That is, you can do some decoration over the sling to make it attractive. Apart from that, you can hang soft toys on the sling.
That sounds awesome. Definitely, I can make it attractive as you said.
Moving forward, let's discuss the cessation of sling use. Mihiraa, it usually takes 3 to 6 weeks to remove the sling, but it may vary depending on the fracture site. The point to be noted is that the sling will not be removed until she is pain-free, and she regains the ability to move her shoulder and arm adequately.
Okay, I understand that. And nurse, Mia is going to a party in a few weeks' time. I hope it will be fine for her to go, because the sling will be off by then. Isn't it?
Yes, I appreciate your question. Mihiraa, you should be very cautious with Mia and her activities, even after the removal of the sling. If she feels well, she can resume her normal activities. There are no issues with it. Perhaps, the important factor is to avoid rough play, at least for the next 8 to 12 weeks after sling removal. It is nothing because the bone will still be weak and fragile during the period. In order to avoid the risk of further fracture, care should be taken.
Oh, I see. Thank you for your information. Certainly, I will make sure she is careful when she's playing, even after the sling comes off.
That's great, Mihiraa. Well, do you have any other concerns?
Yes, I would like to know when her follow-up appointment will be.
That is a good question. Actually, no follow-up appointment is necessary for her condition. It is nothing but the undisplaced fractures, requires no supervision after primary care. Usually, after the procedure, there are no chances of complications occurring.
All right then, that's fine.
Mihiraa, even though no follow-up appointment is necessary, there are some situations when you require to see a doctor. I will brief you.
All right.
Some of the cases, like her being in pain at the fracture site after 6 weeks, are unusual and can be a complication.
Okay.
Next is, if she complains of constant pins and needles, which happens when the blood supply to the nerves is cut off, is something to be taken care of. In such situations, you should always seek medical help.
Okay. I will take care of it, and I will contact the doctor if there are any problems. But I hope her fracture will heal quickly.
Definitely. Those are rare to happen. Mihiraa, always feel free to contact us for further queries. I wish your daughter a speedy recovery.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.